Anesthesiologist says you're going off to sleep now, but what happens right after you're induced under general anesthesia? Once you're unconscious, our first and utmost important priority is securing your airway. We've given you enough anesthesia to stop any drive your body has to breathe. Your diaphragm and respiratory muscles can no longer assist with your breathing because we've temporarily paralyzed those muscles with medications. Airway management is so routine in general anesthesia, but it's important to understand the gravity of responsibility we have to make sure we can ventilate and oxygenate the patient after we've given you medications to stop breathing. If we cannot, the consequences can be catastrophic. So what do we usually do first? We ventilate you through a mask. As long as there's no contraindications like a full belly, once we can ventilate you, we're more assured that this is our fallback to help you breathe and buy us time if we can't intubate. Once we've ensured we can ventilate you, we make our first attempt to intubation, either through a direct technique with a Mac or Miller blade or via video with the glide scope, which is a hyperangulated blade with a camera at the end for continuous visualization. If we can't ventilate with a mask and can't intubate after multiple attempts, we try to place an LMA or a laryngeal mask airway and call for backup immediately. An LMA is a device that sits right above your vocal cords and can help us ventilate you when mask ventilation or intubation is difficult. If we can ventilate you via LMA or mask when intubation attempts have been unsuccessful, we reverse all our medications and try to wake you up and allow for the anesthesia to wear off until you're awake and cancel the surgery. If we can't intubate and can't ventilate, this is an anesthesiologist's worst day and usually results in a surgical airway such as a cricothyroidotomy, where we make a small incision in your neck and in your airway and insert a tube directly in your trachea to help you breathe and give you oxygen. Every anesthesiologist has trained to walk through this algorithm in seconds because this type of quick decision making could mean life or death. So next time you're under, know you're in good hands by doctors who are masters in the airway, and we're doing a little more than working on our crossword puzzles right after you're under.